Hello, everyone. Thank you for joining today's round. We have the pleasure of welcoming Dr. Mona Ben Emra, who is a nephrologist trained at the University of Paris in France. And she recently enrolled in the PhD in mental health under the supervision of Dr. Soham Rej and Dr. Rita Suri. And today she will present part of her PhD project, which is about virtual reality use for exercise in hemodialysis. We look forward to your presentation. Pardon, Mona, j'ai oublié d'activer la caméra.
Hi everyone, thank you for having me and thank you for the kind introduction. Juste pour vérifier, ça va être.
Oui, si tu cliques sur la slide, ça devrait fonctionner.
Mais quoi, c'est les flèches en bas à droite? Ok, ouais. Okay. Parfait. I'm really privileged to be supervised by Dr. Rej and Dr. Suri. It's a research project for the degree of PhD in mental health. And because Dr. Rej is retiring, he's already in India, Dr. Kylwin Greenway has very kindly accepted to supervise me for the psychiatry part, and Dr. Suri is a nephrologist. So this is my land and management, my disclosures. So as Vincent said, I'm a nephrologist. So I work mainly with people living with an end-stage kidney disease and hemodialysis. So I want to share with you the burden of this disease and of the treatment on their mental and physical health, and tell you why I believe that physical activity and exercise can help, how it works in the real world, and why we may be needing an innovative tool such as virtual reality. And then I will move on to my proposal, which is a two-part study. It's the co-design of a new exercise program based on virtual reality and a feasibility randomized control trial. So maybe you're not familiar with these patients, so I wanted to tell you a little bit more about them. There are around 30,000 patients in Canada who are living with an end-stage kidney disease, meaning that they need a renal replacement therapy to remove the waste from their blood to sustain their life. And to do so, they typically go on hemodialysis sessions 4 hours, 3 times per week. There are other modalities, but the focus today will be on that. So those people, because of the disease and also because of the treatment, experience a lot of unpleasant symptoms. So the symptoms related to the advanced kidney disease are usually called uremic symptoms because uremic toxins accumulate and unfortunately can't be totally removed by hemodialysis. And also hemodialysis is responsible often for hypoperfusion of the brain and the heart. So there are, in a way, unfortunately, we are aggravating some of the cardiovascular and even neurological conditions of our patient when hemodialysis is too vigorous, because we have to remove very quickly in 4 hours a lot of liquids, a lot of salt, and a lot of other molecules. And often, end-stage kidney disease and hemodialysis are associated with sarcopenia. So sarcopenia is a phenomenon of muscle wasting, which is associated with fatigue, slow gait, physical inactivity, and frailty. So at the end of the day, because of those conditions, people experience physical decline, poor mental health, low quality of life, and they feel very much disabled by hemodialysis. I won't go into too much details, but I just want to let you know that there are a lot of factors contributing to their poor mental and physical health. And unfortunately, the strategies that are usually efficient for the general population are useless for hemodialysis. So, for example, antidepressants are not very effective. For example, we have 3 RCTs in hemodialysis which show no benefit of sertraline. And because we are happy to have Vincent's sisters, who is a cardiologist, I just want to tell you that unfortunately statins, anticoagulants, and the control of weight are not efficient also for patients. We have paradoxical patterns and responses. So another important fact is that depression and anxiety are highly prevalent in hemodialysis, more than in general population. For depression, it is 20 to 30%. Anxiety, it is between 30 and 46%. And quality of life is very low. They have terrible constraints of time and also constraints related to financial burden, to transportation. So this is a very sad case of a woman from First Nations who has been relocated to Quebec and is still stuck there 6 years later because there is no dialysis facility where she lives. So we believe, because there is a lot of evidence in literature, in the real world, so there are RCTs and there are systematic reviews that show that physical activity and exercise improve physical and mental health in people living with hemodialysis. So we know that it improves the unpleasant symptoms, the quality of life, the mortality, and also those phenomena of sarcopenia and frailty. We even have a very precise clinical practice guidelines on exercise and lifestyle, which recommend for patients 150 minutes of moderate intensity activity a week, or 75 minutes of vigorous activity, or a mixture of both, a combination of outside and during hemodialysis exercise. And we also have recommendations for facilities. Exercise has to be supervised by qualified healthcare professionals in exercise or rehab. And we also need to address the barriers related to staff and patients to optimize participation and adherence. So we have the evidence, we have the guidelines. So how good are we at implementing exercise programs in hemodialysis? So we have data from observational studies. So, for example, this study has looked at what is going on in dialysis with exercise in more than 200 facilities across the world in 12 countries. So we know, I haven't shown all the figures and tables, but in Canada, 44% of hemodialysis patients are totally inactive. But the good news is that there is a certain heterogeneity across the world and even in the same country across regions. So, for example, we have some champions in Canada, such as Dr. Baum and Dr. Thompson, who are in Manitoba and Alberta. So maybe Alberta is the province in Canada which embodies this value of exercise is medicine. So this is kind of a very strong philosophy. Even with nurses, they do a lot of sports. They are champions. So in Alberta, at that time, around 2000, 50% of people were doing some kind of exercise either during dialysis or outside dialysis. And it was very well tolerated because a frequent side effect of dialysis is drops in blood pressure. But with exercise, It may be surprising, but it was less than 1% of drops in blood pressure. And I talked with Dr. Thompson recently, and she told me that now they were reaching 80%, 90% of success for exercise in dialysis with patients. So what are the barriers? Related to staff, it's the lack of staff, the lack of training. So personally, I don't know if you were luckier here in Quebec, but personally, I had no training in nutrition, in psychology, in exercise during my very long studies. So I had to learn that later on, mainly by myself. We have constraints of time, and we have false beliefs. So sometimes we consider that people are too frail or that they do not want to exercise. But sometimes the patients want to exercise, but they don't know the how to and where to begin. Maybe we have too much focus on moderate and vigorous activity only. We have talked about 150 minutes of vigorous or moderate activity. The truth is those people are very vulnerable. They are very frail. So maybe there is an in-between solution to help them move anyhow. We lack equipment, dedicated space, and funding. And for patients, there is the fear of movement, the lack of motivation, the lack of energy, some kind of limitations, either cognitive or physical. And sometimes they get very bored because they consider that we only offer cycling, for example, in dialysis. So to address these issues of participation, adherence, motivation, we thought about using an innovative tool, the virtual reality, which is very successful for behavioral interventions in healthcare. There are two main types: non-immersive and immersive. So let's talk first about the immersive type. So we have a headset. So this is a head-mounted display. There are screens built inside where people can see a landscape and they can have a stereo surrounding. And this is a digitally crafted 3D space. And in that space, users can interact with their environment, avatars, objects by using these specialized gears. They may use also controllers and wearable sensors, as you can see above on the ankles, on the wrists. These sensors give feedback to the system to adapt the intensity of the exercise. So on the left, you can see a non-immersive virtual reality, which uses huge panoramic screens with a specific technology where this young boy who has a cerebral palsy can see himself on the screen, and this gamifies and intensifies the immersion and the experience. And this technology is used for rehab in several provinces in Canada, mainly for cerebral palsy, neurodegenerative diseases, and stroke, and has shown pretty interesting results. Immersive virtual reality has been used too for stroke and has shown a very good effect on balance, gait, and on the risks of falls. In hemodialysis, there are experiences too, mainly non-immersive virtual reality. So you can see here this gentleman who is sitting while doing his hemodialysis. He is picking targets that the screen is projecting. And there is also some experiences with immersive virtual reality. There is a program, a mindfulness program, which has been used in the United States, and also two other programs. in hemodialysis. So don't be scared by this table. It's a review we are going to publish soon of the 9th study, which have been conducted in hemodialysis. They are mainly non-immersive, except for the 2 last ones. And what we can see is that those programs have been deemed feasible, acceptable, safe. People seem to be adherent. It was someone between 70% and 100% of adherence, which is good in that population. And the main results for 6 studies over 9 were positive results with improved fitness, body composition, fatigue, physical function. In 3 studies, there was no difference. And 1 study has shown decreased anxiety, depression, and inflammation markers. So those data suggest that virtual reality-based exercise is superior to traditional training. It has been shown clearly for neurorehabilitation, for outcomes such as mobility, balance, gait, pain management, quality of life. The interventions are safe, and it seems like people can obtain a higher duration of exercise because it's fun, because the experience is gamified, and people want more, especially in pediatrics. With time, it can decrease the workload of kinesiologists, and there's a signal for efficacy also in hemodialysis. So again, the mechanisms are the engagement, the playfulness, and maybe an enhancement of attention and concentration. So we believe that this is an interesting tool. So we want to try it out. We have chosen to try the immersive version of virtual reality because it may give a high quality systemic experience to patients. And we want to co-design a program with patient partners. So we want to include them at the very beginning to be sure that it's going to be tailored to their needs. So this is the first part of the study, so the co-creation. We would like to recruit 4 to 6 patients who are living with hemodialysis or who had a previous experience and who are now maybe transplanted. A kinesiologist, some medical doctors like me, and we will partner with industry, so with a virtual reality designer. We already have a partner. His name is Super Splendid, and I will tell you a little bit more about what they have already done in a second. So this first part is a 6 months duration. It will be the co-creation process and also the beta test, the integration of patients' input who will make a lot of emphasis on their feedback. And the objective is to create those exergames. So exergames, the contraction of exercise and gaming. It's a word from the physiology of sports, because it has been shown that it enhances the motivation and the results in general population and in other chronic conditions. So we will use the framework of a human-centered design. We will try through teamwork to generate ideas and convert those ideas into a prototype while using continuously the user feedback to improve our prototype. So there is a very precise framework. We can discuss that in the Q&A, but maybe we can expect some key principles to guarantee that we can share power and ownership of research with patient partners, that we can get mutual and reciprocal benefit, Empathy is very important to embrace the plurality of knowledge forms because people will be coming from different backgrounds and may express their ideas or their experiences differently. And we will try to guarantee agency for all. So again, the goal is to obtain a final prototype that we can submit to external feedback to a larger audience, healthcare professionals and patients, and also try to have administrators and the people responsible for paying to embark on that. Now let's talk about the second part of the study, which is the pilot feasibility randomized control trial of this virtual reality-based exercise program. So we will recruit hemodialysis patients. So for the pilot part, we would like to recruit 26 patients, 13 in the exercise arm and 13 in the control arm. So when we will recruit them, we will do a baseline period during which we are going to record with an accelerometer the physical activity and the exercise they engage in at their baseline during 2 weeks. We will have also initial physical function tests, mental health and quality of life questionnaires. After those 2 weeks, we will have a coaching session for all, then the randomization, and then we will have the virtual reality exercise group. And the other group is a virtual reality recreation program that does already exist. The name is Toujours Dimanche. It has been created by this industry partner, Super Splendid. And it has been broadcasted mainly in palliative care, long-term care in the elderly, and it is very much appreciated, and it is even more widely broadcasted in the Quebec healthcare facility centers. So it enables people who are bedridden to travel through these programs. So they can go, to L'Île d'Orléans or whatever, and so it is safe. There is no signal for important cyber sickness effects, and we wanted an active control group to have. Because it's important for motivation, everyone will get some virtual reality. And we also want to see, is it only, the novelty, the fact that you have virtual reality that improves any outcome, or is it really exercise? We will measure outcomes at 8 weeks. It will be the mid-study evaluation. The intervention will end at 16 weeks. We wanted a longer period of study because a lot of studies that have been published are very short, 4 weeks, and it was not possible to conclude on a real effect. So we want to maximize our chances to see an effect. At 16 weeks, we will look at the short-term outcomes, and then 10 weeks later, we will look at long-term outcomes. We want to see if it's only a honeymoon effect of the VR, or if there is something or robust on physical activity on a regular basis. And we will do some quantitative research with patients and staff to see all the other aspects, like is it cumbersome, go in the way of the workload of the nurses and the physicians, patients who do not participate, etc. So what are my objectives? I want to test this program versus the active control group using the recreational VR program. I want to see if this virtuation can increase or not the number of minutes spent on physical activity and exercise per week. My hypothesis is that the program is feasible, acceptable, safe, and will increase the number of minutes spent on physical activity. And the outcomes that I will look at, because it's a pilot feasibility trial, I want mainly to be sure that I am able to recruit at least 2 patients per month over a period of 14 months. See if people are able to complete 80% of the sessions. The activity entails a qualitative study. The safety will entail to look at the cyber sickness, so the sickness related to the use of the screens, the virtual reality technology, and other adverse events, drops, pressure, any hemodynamic clearance, or any other effect that people will report. And for the outcomes, we want to look at the number of minutes of physical activity and exercise, and also physical function. And we will go through exploratory outcomes about health and quality of life, and some more details on that.
Voilà, on peut peut-être mettre sur mute la personne qui. Si tu cliques sur le. Ouais, tu fais un clic droit sur le nom, un peu plus. Le petit nom. Ça fonctionne.
Alors. So about physical function tests, I have chosen tests that have been validated in the elderly and in hemodialysis. So the 6-minute walking test, it's a very good test to look at endurance, aerobic capacity, and it is very much related to longevity. The timed and go, which is also correlated to strength, longevity, and independence in life. The short physical performance battery will give more information about gait, balance, mobility. For the questionnaires, we will look at the simulator questionnaire, the quality of life, and priority. And for the exploratory outcomes, we say that we want to look at the number of minutes of physical activity before and after the intervention, but it is also very important to look at the sedentary behavior, which is by itself very dangerous for health, and it's a risk factor for mortality. For that, we will use the International Sedentarity Assessment Tool. It is a Canadian tool, very easy to use, and looks mainly at the time spent during the past week on watching screens, sitting driving time versus sitting reading, because it's very interesting that there is a signal in literature saying that sitting and driving are terrible for health, but sitting for reading is very good for health. And for mental health and quality of life, we will use the Edmonton Symptom System Revised Journal. It is a very simple questionnaire, initially coming from the palliative care, adapted to renal diseases, which looks at the most unpleasant symptoms that people experience. One of them being the pruritus. So this is something very important to look at nowadays. So we will look at this because it's exploratory. We will see where there is a signal, and also anxiety, depression, stress, and emotional well-being, and the quality of life. So This is my proposal is the first co-designed immersive virtual reality exercise program for hemodialysis in Canada with patient partners. It will be also the first pilot feasibility RCT, and we want to look at the number of minutes of physical activity and exercise objectively measured with an accelerometer, physical function, mental health, and quality of life. And this will be useful to inform for the design, sample size calculations, and methods for a multicentric pan-Canadian RCT. So I just wanted to end this with that if exercise could be packaged in a pill, it will be the single most widely prescribed and beneficial medicine. Thank you.
Thank you, Wanda. That's a very exciting project. It was a great presentation. It's so good that there's this co-design component for elaborating the intervention, and also that you're using a strong active control. And I feel like this will be strong advantages or strengths of your project relative to previous studies. I'm curious to ask you what you have in mind in terms of the selection of patient partners, because I wonder if there might be generational or populational differences in what kind of game people might be interested in playing. You know, if there's like a younger patient with hemodialysis, they might have slightly different game preferences or game literacy. So do you have a sense of what kind of demographics you want to target?
Yeah, those are very good questions. I guess that I need to be very careful on some biases because the temptation could be to recruit younger patients, motivated patients, or those who are already very familiar with the technology. And I want my study to be very inclusive. So I want elderly, I want both male and females. And it seems like there is a difference in the approach to technology between male, females, or in more general manner according to gender. So I would like to have ideally half male and female. And then I would like to have some older adults. And if I'm lucky enough also to find maybe at least one person who is from the First Nations or from African ancestry or from Asian ancestry, because there may be also differences according to culture and ethnicity. So what we know, because there is a student of SOHAM, Karine Sinaliolu, she has done a study of VR-based mindfulness for stress in older adults. And what was very interesting in her study is that those folks, even if they had a very low digital literacy, it was not an obstacle. They were able to learn very quickly. So there was a specific session to show them how to, and but after that they were okay. So that was interesting, and I'm also interested in not excluding, even for the RCT, not excluding too much people. Like some exclusions are necessary, like hearing loss, epilepsy, very severe psychiatric disorder like psychosis. But otherwise, I would like to have also at least one amputee. We have a lot of amputees in hemodialysis. So those folks need to move, and they need even more the capacity and the strength to stay independent. And I don't want to exclude those who have a mild cognitive impairment, because I think that everyone can play. So I would like to have a diverse, but are we going to be able to do teamwork like that? I don't know. It will be trial and error, but I will try to be inclusive even in that part and not to, because the temptation again is to take the, the smarter, those who are very high-tech people, and no, I don't want to do that.
That will make the intervention all the more inclusive and accessible. Thank you. Is there any question in the room or online? We have a bit of time for discussion.
I have one. It's a very interesting project. Thank you so much for your presentation. And I'm wondering, in theory, virtual reality can help, if you put the exercise part aside, just its impact on neurohormonal stimulation and mental health can have a positive impact for cardiovascular health and hemodialysis toleration. Are you aware of any studies that have looked at the use of VR in hemodialysis without using it for the purpose of some degree of rehab?
Yes. So there is one study in the United States, in Illinois. They have created a program of virtual reality-based meditation. They have called it Joviality. It is guided meditations, and they used it. It was a pilot feasibility study. And the most interesting feature of this intervention is that they had a significant decrease in unpleasant symptoms related to dialysis. So they were not bothered by the cyber sickness, because it's always something that we may fear, like dizziness, headache, and those symptoms can be also provoked by hemodialysis. But in that study, the symptoms were improved. So nausea, feeling lightheaded, and so all the unpleasant symptoms decreased. People were happy to use it. So we don't know exactly why. There are several hypotheses. One is distraction, just like hypnosis or doing something else, because virtual reality has been very much used in child care, in ER, or in the orthopedic hospital, the Shriners, for needling or for any painful procedure. They have implemented those programs several years ago, and it's very successful there in the Shriners and also at Saint Justine, and it works through distraction. So the children, they are also on the internet some testimonies of children who say, especially those who have a chronic condition, that before they were fearing to go to the hospital, and now they were looking at it because they will have fun with the virtual reality game. So there are several games that have been developed for that. And there is somewhere at Rimouski, there is no study about that, but they are using a program from another company. The company is called Paper Plan Therapeutics. It is called Calm, and it is for needling the fistula when they have hemodialysis. And it seems like that they are very happy with the distraction they get and the relief of pain. So those are the data that I have. Specifically in cardiovascular disease, I don't know. I should look at it. And so distraction, the mechanisms. In rehab specifically, it seems like there is more attention, more concentration, more engagement, and maybe a signal for neuroplasticity. And because it is a lot used in pediatrics, children want to play. And for example, those children who have cerebral palsy, they can't get enough of their program. Whereas when they had the traditional rehab, it was boring and they were not very much interested. So gamifying the experience may be an avenue.
That's very interesting. And possibly there must be studies as well in chemotherapy is something that I think is similar in some ways to hemodialysis patients where they have to sit there for long hours. And then putting them in an environment that's more stimulating, more engaging, might help improve the outcomes of the treatment. And plus, if you add on exercise on top of that, then you improve also their quality of life outside of hemodialysis. I think it's a very interesting project. Congratulations.
Thank you. And the industry partner with its program, Toujours Dimanche, this program is used in palliative care and people like it very much.
Very good. Interesting.
But yeah, and there is another team working on that. It's Bassam Khoury in counseling psychology who works more specifically on embodied and embedded meditation with compassion, a lot of self-compassion and exposure to nature. They have partnered also with the same industry partner and they have conducted a study in les RPA, les résidences pour personnes âgées, so community dwelling adults, older adults, and they have used this program and they had interesting results in enhancing resilience and compassion through this virtual reality meditation program.
Very interesting.
Yes.
Well, thank you so much, Mona. That was a very exciting presentation, and we look forward to you maybe coming back in a few months or next year, telling us about the next step.